Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor who sees lots of back pain patients, this particular study was definitely of interest. And so researchers looked at, this was out of India, small number, but it looked at 40 patients with disc degeneration and compared them to 20 healthy people who had no disc degeneration on MRI. And average age was about 30 to 60. What was interesting was that there was a definite link between alterations in the gut microbiota. So the gut microbiome was less healthy in those with disc degeneration. Their inflammation markers were higher, could be driven by the gut, could just be overall inflammation. And also the short chain fatty acid producers were lower. So generally, when we have a healthier gut, it produces short chain fatty acids. Those have other health effects. But the bottom line is there was definitely a relationship between the bacterial makeup and the risk of disc degeneration in this population. Does this mean that the gut creates problems in the disc? It's not that simple. There was some studies recently that found acne Q2, one of the acne versions of, so basically like a skin bacteria that they found growing in the intervertebral discs that were degenerated. So it really raised this question, like maybe antibiotics would help with disc degeneration, and that's probably never going to be the answer. It's not that clear, or it's not that straightforward, and I doubt that antibiotics will solve people's low back pain. And as a matter of fact, those antibiotics will screw up the gut and lead to these kind of altered gut microbiome that's going to cause degeneration of the disc. The bottom line is that disc degeneration is not about like, hey, go to see a chiropractor 3 times a week for the rest of your natural born life. Like, that's not going to save you if you're doing all kinds of other things wrong. Our exercise level, our risk of cardiovascular disease, in this particular case, the gut microbiome, if you're a smoker, like all of these things play a role in disc degeneration. And it means that you can be active, you can be flexible, you can do yoga, but if the rest of your lifestyle is shit, it's not going to help. You're probably still going to be at risk of disc degeneration. And the gut microbiome probably contributes to that. And poor lifestyles probably contribute to an unhealthy microbiome, so they probably feed forward and make the situation even worse. On the flip side, if you take care of yourself, then you're probably going to have a healthier microbiome. Interestingly enough, you could suggest that antibiotics, because they have such a decimating effect on the gut microbiome, might actually increase the risk of disc degeneration in the future. Certainly there might be some studies on that. I did not look at any prior to doing this video, but now that I said that, it makes me kind of want to look at that. If you want to avoid disc degeneration, it's about everything. Certainly as a chiropractor, I think that seeing once a month, once a quarter, once a year, seeing a chiropractor I think is a good idea, but it is not even close to the only thing that you need to do to avoid or slow or have a positive effect on the presence of disc degeneration. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.